Well, good afternoon, everyone. Dr. Fitzgerald, our Chief Medical Officer, is on the line today, so we will go directly to our Chief Medical Officer, Dr. Fitzgerald, for the overnight update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. I'll begin with an update on the number of cases in our province. Since the media briefing yesterday, we have 4 new positive cases. All of these cases are within the Eastern Health region, and the public health contact tracing is ongoing. Everyone considered close contacts will be advised to quarantine. The total number of cases in our province is now 152. We have 143 cases in Eastern Health, 3 in Central Health, 1 in Western Health, and 5 in Labrador-Grenville Health. Of our 152 cases, 120 are related to Call's funeral home, based on the latest information I received last evening. 56% of cases are female, 44% male. By age, we have 13 people under the age of 20, 24 between 20 and 39, 23 between 40 and 49, 32 between 50 and 59, 30 between 60 and 69, and 30 who are 70 or above. 11 people have been admitted to hospital due to the virus. Of these patients, 2 are in intensive care. 7 people have now recovered. In total, we have tested 2,575 people. Of those individuals, 2,423 were confirmed negative. I must stress that just because the number of confirmed cases being reported today is lower than it has been in recent days, this does not mean that you can ignore the emergency public health orders currently in place. The COVID-19 virus is in our communities, and we are still at the beginning of this pandemic. I implore you to continue to do your part to slow the spread of COVID-19 and help flatten the curve in our province. We are still at a pivotal point where we can do this. A point of clarification regarding those who attended Call's funeral home and who were subject to the order to self-isolate. Please note the order ends tomorrow for those who remain without symptoms. If you have symptoms and are being followed by public health, or you have been tested, you are to remain in isolation until released by public health. I would now like to clarify a couple of points related to the orders I announced yesterday. The first relates to the sale of lotto-type tickets in stores. While the purchase of scratch and pull tab tickets is prohibited, people may still purchase online lotteries such as 649 and Lotto Max. The rationale behind this is simple. We must avoid people congregating in stores, scratching and pulling tabs from tickets. Having people in stores for extended periods of time makes the principles of physical and social distancing impossible. Please only go out for essential products such as food, personal care products, and medications. Further, I would also like to clarify the order related to funerals. Funeral services, public wakes, and visitations have been canceled. Burials can take place with up to 5 people in attendance, including the officiant. A private viewing of up to 5 family members before the burial is also permitted under this order. However, precautions including physical distancing of 2 arms lengths and hand hygiene must be followed. Virtual options should also be accommodated where possible and appropriate. Please know that issuing the order related to funerals has been one of the most difficult decisions I have had to make during this pandemic. In a time that is already extremely difficult on a grieving family, my intent is not to further distress, but to protect all of us by minimizing the spread of this virus. I also wish to advise that I am ordering the closure of campsites at municipal and privately owned parks. I still encourage everyone not self-isolating to enjoy the outdoors. Again, please keep physical distancing in mind as you snowshoe and walk the trails. This afternoon, government and the Newfoundland and Labrador Centre for Health Information have launched a website so that individuals in our province who have been tested for COVID-19 can securely access their test results online from a computer or mobile device. This is an important tool in our fight against COVID-19. By letting people check their personal COVID-19 results online, we will free up time for healthcare workers to spend on contact tracing. Once you have taken an in-person test, you can go online using a computer or your mobile device and visit healthenl.ca, that's HEALTHENL.ca, mcpnl.ca/COVID results. Once there, enter your name, birth date, MCP, and MCP expiry number in order to get your result. If you choose not to view your results online, a member of Public Health will call you with your results. This tool will tell you if your test comes back negative. It will also tell you if your test result is not yet available. Please remember that it can take up to 5 days to receive your test result. If you have a positive test result, you will get a phone call from a public health official. If you test positive, you will receive medical guidance on how to treat COVID-19 at home, contain its spread, and if and when to seek further medical attention. Please remember that even if you test negative, you are still required to self-isolate for 14 days. Our government's COVID-19 website has recently been redesigned in order to present you with the most accurate, up-to-date information related to COVID-19 in an easy-to-navigate format. This includes information such as guidance on how to self-isolate, operational requirements for businesses, travel advisories, and tips on how to stay safe and well. I would encourage each of you to visit gov.nl.ca/COVID-19 daily for information and updates. As a recap, for those who may have just joined us, we have 4 new cases since yesterday's media availability. The total number of cases in the province is 152. The breakdown by health regions brings us to 143 cases in Eastern Health, 3 in Central Health, 1 in Western Health, and 5 in Labrador-Grenville Health. As I've said many times before, it is normal for people to feel anxious during these uncertain times. And please know that you are not alone. We are all in this together. In today's world of technology, we are fortunate to have access to many evidence-based mental health and addictions programs and services here locally. These programs are available to people of all ages, are confidential and free, and are available by visiting bridgethegap.ca, and that's gap with 2 P's. Thank you to everyone doing their part to help reduce the spread of COVID-19 in our province by staying in unless essential, practicing physical distancing, washing your hands frequently and well, and staying home if you are sick. Our collective actions will have significant impact on how COVID-19 progresses in our province. Thank you.
Thank you, Dr. Fitzgerald, and good afternoon, everyone. Well, it may seem like today is a better result coming from the heartbreaking day that we had in our province just yesterday, but it is not. It is not in any way, shape, or form mean that we can be complacent. Now is not a time to celebrate. Now is not a time to relax. The health guidelines that we have put in place must remain your top priority. So let me be clear, we are still in a public health state of emergency, and your actions today will determine what the virus looks like tomorrow. So if we take that a step further, your actions today determines who this virus affects tomorrow. If you relax on the measures that we put in place, it could be your family member that we will be talking about tomorrow. So what we need is, once again, is for everyone to display responsible and safe actions that we put in place. There is an online public report form available to you on the COVID-19 website. And as you know, our government has been working behind the scenes to ensure that we have supports and services in place for all areas in our communities. And today I want to talk a little bit about income support benefits. As they say, the check is in the mail. Well, your checks are in the mail for those of you that are receiving your income support by mail. We're pleased to say that 96% of the clients that are currently receiving payments, they get so by direct deposit. Now, direct deposit online is definitely the preferred option. It is the best option. And for those of you that have not already signed up for direct deposit, we urge you to contact the Department of Advanced Education, Skills and Labor, to arrange for direct deposit. We have a toll-free number, or you can go to our website, aesl@gov.nl.ca. We also know, and as Dr. Fitzgerald said, she talked about MCP. We also know that we have some cards that the MCP cards would expire on March the 1st. Well, I wanted to let you know today that as a result of the pandemic, we are extending the MCP coverage to June the 30th. So this includes all individuals whose MCP eligibility would otherwise expire on March 1st. However, it does not include those who are permanently moved away from the province. This extension is to preserve the public health coverage for those of you who are outside the province or country and maybe also challenged to return as a result of the pandemic. So what we're saying here, cards expiring will now be extended to June the 30th. This also includes coverage for international students and workers whose study and work durations within the province have been extended. And also for those of you that could be experiencing difficulties obtaining documentation from your post-secondary institutions or your employers, which from time to time is necessary for your MCP coverage. And for those health providers that would have questions related to this, you can contact the MCP office for confirmation of coverage. We are also getting a fair amount of questions around the K-12 education system. So the Department of Education and Early Childhood Development, who is responsible for public exams, they are in partnership with the school districts, and they have been working very closely to determine the next step for our high school students. The department has also been in contact with the province's public post-secondary institutions, specifically on planning for students who are graduating this year. So we want to let you know that the plan is being developed, and we should get this finalized very soon. And so not only is your government working to ensure that the supports are in place to help you through this, we're also working very closely with the federal government. And Minister Osborne, of course, is the minister responsible for finance. He was on a call last night with his federal counterparts and relayed once again the challenges that we are facing in Newfoundland and Labrador that are very different, unique to our province, very different than what you would see in other provinces. But the main focus on all of us right now in all our departments is on COVID-19. And we will certainly address the other issues once we get this through this pandemic. But not only are we seeing supports from all areas of government, we're seeing still communities and industry members that are stepping up. And just recently we had a company, Takora, which is a mining company in Labrador West. They recognize the great work that's being done by our frontline healthcare workers. And they, in conjunction with Provincial Airlines from Takora, they donated some 20,000 N95 masks, and Provincial Airlines will be delivering them from Walbush. I had some questions yesterday about the Newfoundland Labrador Liquor Commission, the NLC, who have produced already some 9,000 liters of hand sanitizer to date, and there's more underway, and that is being shipped to our health authorities. And all of this is to support the COVID-19 response. So the question yesterday was around a contract or how much government or you would have to pay for this. Well, there's no charge to our government for this hand sanitizer, which we know we've been experiencing some shortages. So the examples that I give here are some small sacrifices for what's required for our communities to take on this large task. As the old saying goes, I guess, it takes a village, and we thank everyone who is assisting in our time of need. There's also been a lot of questions over social media, and I know media outlets doing what we can to break this information down for you. There's a lot of information that will come out daily, but once again, you will get the most up-to-date, factual, trusted information on gov.nl.ca/COVID-19. This website, as I said, is the trusted space for factual information. There's some frequently asked questions that are top of mind for most people as they think about their experience. Some of the myth busters, answers and responses that would be on that website as well. But there's also some information there on federal support for individuals and businesses, as this comes out really on a daily basis now. Also about what services would be open or closed at this particular point in time. So while we stay connected to keep up to date with the information coming, we must all remember we can stay connected with family and friends simply by picking up the phone or video call family and friends. And we know, as a province, we know how to face adversity, and let us all do our part to flatten the curve together. This is where we, as Newfoundlanders and Labradorians, this is where we shine. So what we all have to realize is that we do have a cure for COVID-19. The cure simply is staying apart and keeping safe physical distancing. So thank you once again. I now turn it over to Minister Haggie for a few comments.
Thank you, Premier. Dr. Fitzgerald's remarks have painted the picture today of what looks like an optimistic decrease in numbers, but I think it really is crucial that we remember there is no time for complacency. We are not out of the woods yet. If you could remember the history of how this condition arrived here, it arrived from other provinces and through travel, and we are in general lagging about 2 weeks behind the rest of mainland Canada. If you want to know the potential for what could come here, look no further than Ontario and Quebec today and see the challenges that they face. It is crucial that Dr. Fitzgerald's orders are followed and respected. These are simply some of the most restrictive changes to everyday life in this province since wartime in Europe, and that is no exaggeration. To those of you who were in that first group of people involved in the Coles Funeral Home spread, those of you who will be coming out of isolation tomorrow, you're not let off the leash. You're not to run free. You are to go and stay and respect the principles of self-distancing, of physical distancing. It is important, however, that you also realize that that doesn't necessarily mean social isolation. You can stay connected, but you must stay apart. Some of the questions I've received have been around the issues of people coming into the province. It is quite clear from Dr. Fitzgerald's recommendations and the orders she has written that anyone arriving in this province from anywhere outside of Newfoundland and Labrador is required to self-isolate for 14 days. That includes anybody, workers from out of the province. So if you write to me or my staff and say, well, I've come from up north, or I've been working in Baffin Island, the oil patch in Alberta, Nova Scotia, or the Great Lakes boats, it does not matter. When you set foot in Newfoundland and Labrador, you are required. It is your duty, it is your responsibility to self-isolate for 14 days with no exception. If you experience troubles and worried about illness, we have a variety of options. We have the self-assessment tool, we have 811, and should you find yourself critically ill, then you can call 911. If you do that, please notify the dispatcher or the person you're speaking to that you have traveled outside the province. Dr. Fitzgerald announced a major step in what has been labeled digital by design. It's part of a long-standing plan from government and from the Health and Community Services Department to try and move to online services. I have to congratulate the Newfoundland and Labrador Centre for Health Information in moving this along expeditiously, and now for people who have test results, they can access those through the portal that Dr. Fitzgerald has described. This is a first step along what I hope will be a long road, and it's one of the ways that innovation spurred by these kind of issues is helping us move ahead quicker. We have moved into the virtual care space. There are currently now 391 practitioners across the province who have requested virtual care access, and that can be telephone or it can be FaceTime equivalents. I would encourage you to contact your own primary care provider to see if they are one of this group of 391 and are able to provide care for you by physical distancing and yet connected. From the point of view of virtual care as well, we're looking at ways of trying to increase accessibility of the general public to nurse practitioner services. Premier has referenced the MCP changes. We've simply extended the current coverage into the end of June of this year. That may need to be revised depending on when and how our surge arrives and how long it lasts and how long our lockdown persists. This is, for those people who would be affected, something obviously of concern, but be assured your coverage is maintained. You may not get a new MCP card, but that doesn't matter. And as the Premier referenced, your practitioner can always contact MCP directly to ensure you're covered. So my final comments are really, again, we must be diligent, we must be dutiful, and listen to the recommendations and orders of Dr. Fitzgerald. So stay home, stay safe, but you can still stay connected. Thank you very much, Premier.
Thank you. So we now open it up to the media for some questions.
For the benefit of our speakers, we have 7 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions and 1 follow-up. We will run through the telephone queue, so each is given an opportunity. Following this, should time permit, I will ask if there are any further questions. I reiterate that we have 7 reporters on the line, and we want each of you to be able to ask questions. This call will end at 2:59 p.m., and any further questions can be emailed. Operator, please proceed.
Thank you. Please press star 1 at this time if you have a question. The first question is from Ben Murphy from BOCM News. Please go ahead.
Mr. Haggie, some people with newborns set to get their children vaccinated for the first time, they're concerned about taking them to public health offices and being treated possibly by a nurse who may be dealing with COVID-19 testing. What do you say to these parents?
The public health nurses are skilled in both vaccinations and in the tasks required for COVID-19 supervision. I would reassure people that those individuals use appropriate PPE and that no one is trying or will do anything that would put you or your baby at risk. I think it's very good and very conscientious of parents to continue with vaccination under these circumstances. We have the best child vaccination rates in the country, and that's something to be proud of. And hopefully in the future, we will have a vaccine for coronavirus too.
Is there any kind of solution being put in place or worked on for people like oil field workers who are from here traveling to Alberta for work, and they, don't always want to go? Many are being told that they have the option to fly out and go to work, get paid, or stay home, and they don't want to go take that risk. Is there any kind of support being put in place for these people?
So the support for individuals, no matter which province you live in, would be through the federal programs. And we're seeing some opportunities, and that information is available on our website as well. But from a provincial point of view, if you're an Alberta worker, well, you make a decision to stay in Newfoundland and Labrador. Well, there will be federal programs there that will be available shortly, within the next few days, and applications, I understand, will be available that could be filled in as of April the 6th, but there will be federal programs to support you. There are no provincial programs to support Alberta workers or those working outside the province.
And will Newfoundland Power Hydro be giving any breaks to its customers during this crisis in terms of discounts or incentives? As with everyone home all day, power bills and light bills are no doubt going to go up.
Yeah, so we're seeing other provinces that have taken measures to defer payments. We've been working with the utilities here in Newfoundland and Labrador. There's an agreement that no one would be cut off. They would not be able to receive their electricity during this particular point in time as a result of COVID-19. But I'm currently working with the Minister of Finance. We talk about this we were chatting about this just yesterday, and the Minister for Natural Resources. So we have the departments engaged now to see what opportunities would be to work with individuals in our province.
Thank you very much.
Thank you. The next question is from Peter Cowan from CBC News. Please go ahead.
Dr. Theresa Tam has said nationally over the weekend people shouldn't go to rural areas. I know lots of people in St. John's are hearing social distancing. They're heading out to their cabins around the bay. What sort of advice do you have for people who may have cabins or other rural areas to go to?
From my point of view, I would suggest that it depends on what you're going to do wherever you are. If you're going to go to the cabin, then you need to maintain the principles of physical distancing. It may be harder to be socially connected at your cabin under those circumstances. Traditionally, we all know that literally cabin parties are part of the fabric of weekend life here, particularly when the snowmobiling is good. But those are adjustments that it's really crucial to make. My worry is, having traveled home last weekend, seeing lots of pickups by the side of the road in clumps, and worrying that what people are doing is they're socially connected and physically distant at home, but they're socially connected and physically connected when they're in the woods, and that really undoes it all.
The virus doesn't have a postal code, and it doesn't respect postal code or communities or locations. So you're just, if you do not practice the guidelines that have been put in place, like Minister Haggie said, you're just as exposed on some pond or lake in remote Newfoundland and Labrador if you're around a crowd of people as you are in downtown St. John's.
We've heard concerns from seniors about dispensing fees and the fact that because they now have to go every month instead of every 3 months, they're paying 3 times as much. There were discussions in the works. Why not just have the province cover those dispensing fees like we're seeing other provinces like New Brunswick do?
We have a situation where the Pharmacy Board, who has complete control over the standard of practice of pharmacists, has mandated that their members do a 30-day dispense. This is something we can't influence. We've tried discussions, and they are adamant that this is where they need to be because of security of drug supply. From a public health perspective, this is counterintuitive. We would like people to go much less. And that remains a philosophical difference between us and them, which is as yet unresolved. We are responsible for 130,000 people or thereabouts under the NLPDP, and we have allocated money to pay those dispense fees for those individuals covered. That will amount to about $3.5 million extra over the next 6 months, and if it lasts a year, obviously around the $7 million mark.
But that doesn't address people who have private insurance or seniors who are paying for medications out of their own pocket, for example. What's being done to help them?
The issue there is obviously of concern to us, but quite frankly, from a government perspective at the moment, our first responsibility has been to take care of those people for whom we have a specific responsibility under the NLPDP. The issue of private insurance, I obviously can't talk about. It's outside my mandate. With regards to those seniors who fall in the gap between the NLPDP and private insurance, we have had discussions and are still having discussions with seniors representatives about what we can do to help them.
Thank you. The next question is from Patrick Butler from Radio-Canada. Please go ahead.
Hi, I'm looking for an update on how many healthcare workers in total in the province are self-isolating, and I wonder if you could also give a breakdown by region.
I can't get you a total number just off the top of my head, Patrick. The last information I had from Eastern Health was that that number was around or greater than 240, but obviously that is old information, and we can find that for you and we'll bring it to you.
And as that number grows, is that creating any sort of, more worries about capacity and whether a lessened workforce would be able to handle the requirements?
It certainly is. I mean, one of the challenges is around the pieces of a pandemic response. Part of it is beds, and part of it is staff for those beds. Let alone the community services that we need to have in place for those people who are managed at home. We have reduced our bed occupancy by almost half over the time since we cut out elective procedures. That gives us staff and beds in acute care that are currently unallocated. So we do have some slack at the moment because the number of admissions has been pretty low as yet. Now, part of the self-isolation piece is related to vacation and travel, and part of it is related to calls. Both of those are starting to, by virtue of the time into the orders that we have, both of those groups are now potentially going to become available to us over the next couple of weeks. So the numbers that you get on any given day are a snapshot. And we're hoping that the measures we took in terms of orders will now allow us to have greater access to those staff over the next week or so.
Can you also give an update on or give some details about the specific COVID-19 units that are being put in place in the province? Where are those going to be located? And at this point, how much, where are we at this point right now?
Well, the units will be on in each of the acute care facilities, and we have 13 what are called Category A facilities, which have 24/7 emergency departments, and they would vary from places like, Western Memorial to Gander, Grand Falls, those kind of places. Each of those units has a floor set aside. They vary in size because the geography of the institution also varies, but they're starting with anywhere between 15 and 25 beds. I think in the Health Science Centre, their unit may actually be as high as 30. They are self-contained areas within the hospital, and obviously that's a starting point. If we need more, then there are plans to expand into other areas of the hospital, if need be, by moving patients out of those areas into other facilities. For example, we will be trying to relocate some alternate level of care patients across Eastern Health in the next few days to free up some beds from the Health Science Centre in St. Clair's.
Thank you. The next question is from Kellyanne Roberts from NTV News. Please go ahead.
Thank you. Minister Haggie, I'm just wanting to clarify on Patrick's last question there. We know that the Munn Field House here has been mobilized. What are the designated overflow areas in each health authority region?
Certainly I can give you those for Eastern Health because we've had those discussions. Each health authority has its own designated area, and we can certainly try and provide those for you. Those overflow areas would be used for non-COVID-19 patients who still required a level of care that couldn't be provided in the community. Exactly where those others are in Central, I couldn't be specific. My understanding in Western is that they're considering the new long-term care facility in Corner Brook that was recently begun commissioning. So it will vary from region to region.
Thank you. And are we able to be informed on what regions those who have recovered are in?
I do have recovered cases. There are currently on my sheet, and as of 9 o'clock this morning, we have 5 recovered in Eastern and 2 recovered in Labrador Grenfell. Those are snapshots in time, and I wouldn't be surprised if those numbers were completely different by tomorrow.
Thank you. Are we also looking at a potential price freeze when it comes to groceries? I know many people seeing an increase in items they would have bought last week that would have been $8 to $12 this week. In a time where finances are tight, are we looking at doing this?
I talked to the local distributors and the grocery owners, on a regular basis, and as of yesterday, that was not part of the discussion. The inventory levels have been, intact for Newfoundland and Labrador. So from a supply side, there's supplies within the province. So in terms of price changes, it's certainly something that I'll add the discussion and kind of drill down into why we're seeing those cost changes. I mean, let's keep in mind as you deliver things into Newfoundland and Labrador, it's fuel is much lower at this point in time. So I'd be very curious to see if we're seeing drastic increases in costs at our grocery stores in particular. So I'm more than willing to have that discussion with the local distributors.
Thank you.
Thank you. The next question is from Peter Jackson from The Telegram. Please go ahead.
Hi, I'm literally asking a question that I got about 30 seconds ago. There are reports. There's actually a Facebook page that tracks tractor trailer traffic, and there are reports that it's down considerably. Someone said that from yesterday that it went from about 40 to 50, 40 to 14, or something to that effect. Is there any indication that we're getting a lot less supplies in, and would that be a threat to any sort of essential supplies that people might need?
Yeah, no, that is not the indication from what I'm receiving in terms of inventory levels. And what I understand, the stores we're asking people to shop less, of course, go out just once a week. So this could be a timing issue. I know most people in the industry would have been preparing for the provincial checks and federal checks and the OAS checks that would have been in the mail just in recent days. So this may be just a timing issue, but so what I know is inventories within the centres themselves, that they have enough sufficient inventory within the system to meet the needs of the province. So it could be just a timing issue, but once again, what we need to be concerned about is the supply of goods. And I'm confident, again, yesterday to know that there's inventory levels to keep our shelves full within the province.
Okay. The other question I have is regarding Marine Atlantic. There's a lot of workers on the ferry who are concerned that they're self-isolating on those ferries. They're not setting foot in Nova Scotia, and yet they also have to self-isolate when they're home. So they're basically just living in this very lonely bubble. Is there anything about their situation that would make them unique to the quarantine rules?
Well, I think what happens here is when you think about it is, they're traveling back and forth and they usually stay on the vessel. And so Marine Atlantic now, as they set their numbers at 100 people on the vessels, so that this really comes down to the level of exposure for people from out of the province. So we even though they may not set foot in North Sydney and Nova Scotia, they are actually having a fair amount of contact with people that would be on that vessel. So we know this is difficult for those workers and those families that you would spend 14 days going back and forth the Gulf on Marine Atlantic, and then when you come back to Port-aux-Basques or wherever your home would be, that you then have to self-isolate for 14 days. So one of the things that might be available, we chatted about this morning with the minister and our group, with our all-party group, this issue came up. And one of the things that we might want to have a discussion with, if the workers are in favor of this, is to just switch up the schedule to a 21-day on, 21-day off. We know that certain employers in Alberta has been able to do that. They've added some time on the schedule, which will allow individuals some days off during their time, at home.
Okay. And I just had one question about home care, which is the personal care homes. There are some reports that they're not getting any kind of help or advice or guidance when it comes to what they should be doing. Is there actually any provincial involvement in their procedures and protocols, or are they basically on their own?
No, it's a very closely regulated sector, and you may recall from previous discussions about standards of care and standards of service and these kind of things. When COVID-19 or coronavirus, as it then was called, came on the scene, our public health groups were in contact with both of the official representatives of the personal care home operators as well as the independents to make sure they were apprised of what information we could supply and what recommendations we would make. There is close contact between the personal care homes and nominated, designated individuals within the regional health authorities who have responsibility for providing that advice, that backup, and that inspection duty. So I think we've got a really tight link with the majority of personal care homes. If you have any evidence to the contrary, then please send it in.
I think what is important to remember here when you look at the personal care home industry and how closely connected it is with long-term care sites. So it's important as a government, as the minister has said, that we maintain the integrity, which rules that we're very similar to what we would see, I know, in terms of visitation and so on. I know most personal care homes that I'm familiar with would have the visitation rules that you would see in long-term care, because it's important that if a resident would have to leave a personal care home to go into a long-term care home, that they would not be bringing the exposure to, something like, COVID-19 to the long-term care home. So, I know my experience, even down to staffing on issues like this here, that the provincial government is directly involved, that they should be working with those owners and those personal care home operators on this pandemic.
Thank you. The next question is from Holly Mackenzie-Furter from the Canadian Press. Please go ahead.
Hi, a question about ICU bed capacity. So, based on information today, 2 of the 98 beds are occupied by COVID-19 cases. Can you give an update as of today of how many beds are occupied by non-COVID cases?
As of 24 hours ago, the bed occupancy across the province on average was 54%. It varies region to region, that percentage. These are snapshots in time. I can't tell you what the corresponding daily bed count is for ICU patients of other causes with that figure too. We can find that out for you, but I think it would be important to note that this is just simply a snapshot in time, and within an hour on either side of it, it can change fairly significantly.
Yeah, and I'm wondering too, based on the infection growth rates that we're seeing, has the province been modeling for kind of when, at a point in time, this could reach a stage where, the capacity of ICU beds would have to be expanded?
We've been doing modeling both on a local basis and through the federal government, and in actual fact, that is the main thrust of Dr. Tam's discussions currently with her provincial counterparts across the country. The challenge is around consistency of data, and it sometimes boils down to what's your day? When does it start? Is it 1 minute past midnight to 1 minute before midnight? Because some provinces have been reporting it midday to midday. And whilst that seems trivial, in our province, where you have a day with 4 or 5 new patients, they come in clusters over the day because of the time that the runs are done. So that can skew the models because these are mathematical guesses. And if you alter the assumptions at the beginning, the output is radically different. But the short answer is we're doing a lot of that work, and we're trying to do it in a way that is realistic and makes sense. The bottom line is whatever model you use, we have not seen the bulk of our cases yet.
Right, so I know it's hard to say, I guess, mathematically put a number on, in 2 weeks or 3 weeks, we might need to expand bed capacity, but is there a range or a time that you're looking at in terms of, being ready to have those spots assembled?
We're trying to improve our readiness every day. We have even a program of converting some rooms across the Regional Health Authority into isolation rooms that traditionally have not been used in that way. And there's a doubling of capacity in isolation rooms alone underway across the RHAs in acute care facilities as we're talking here. Just as an example, the earlier comments about overflow areas for non-COVID patients will actually expand our hospital capacity. The issue of nursing staff and workers in healthcare in general coming back into the workforce after their period of self-isolation has passed over the course of the next week or so will also increase our capacity, because at the end of the day, it's great having beds, but you actually need people to look after the individuals who you put in them. So I would say there's not an hour goes by without some kind of preparatory work being done. It's difficult to be very specific at the moment. We are looking at worst and best case scenarios, but at the moment we look to be on track for what we can predict in a reasonable way. In a middle case scenario, we should be able to manage. Whether we're right, ask me in 3 weeks' time.
Right, and just one question, so an isolation room in an overflow area, could those be used as intensive care beds or be, converted into that kind of space if needed?
The intensive care element is simply a matter of the equipment and the staffing ratio around that patient in the bed. A bed is a bed is a bed. You can put it in an area where, as long as there's enough space, you have the right equipment and the skilled staff, you can call that an intensive care unit bed if you need to.
Thank you.
Thank you. The next question is from Elizabeth Whitten from All Newfoundland and Labrador. Please go ahead.
Thank you. The current count for people testing positive related to the calls cluster has been increasing steadily, and today it's 120 people, and it's the major driver for our numbers. How long is contact tracing expected to last, especially for such a large group?
So contact tracing will continue as long as if we find positive cases that are related, then we will do contact tracing based on those cases, and we'll test anybody who has symptoms or we're suspicious may have COVID-19 disease. So it's difficult to really put a time limit on contact tracing because it will happen as it needs to happen.
Right. And is there any idea of the total number of people that public health officials have had to follow up with for this investigation?
I don't have that number in front of me right now with regard to calls in particular, but certainly it is in the range of hundreds that they've had to follow up, for sure.
Right. And is there any update regarding the case of community spread?
In regards to contact tracing, or?
Yes. What we know is that community spread is where we can't find. Well, I don't need to explain it to you, but
yeah.
I was wondering if we'd had any kind of update or any further developments.
So anyone who would have needed to be, anyone who was a close contact who had to be either tested or asked to go in quarantine would have done so by public health, and that would have happened by now with those cases. So there are no updates beyond that.
Thank you.
Thank you. The next question is from Peter Cowan from CBC News. Please go ahead.
Quebec has closed their stores on Sunday in order to relieve staff and allow time for cleaning. Should we be doing the same thing here?
So once again, this is a discussion that quickly after our media availability just yesterday, there was some messages that would have come in from grocery store operators and others, just speaking to this very issue. For us, what we see and what I've mentioned yesterday, if there was an ability to actually expand your hours, because the situation is one of density, how many people would be in those locations? We're seeing operators that are putting limits on the number of people that would actually go into places like grocery stores and others, and people lining up on the outside in big lineups, and therefore practicing safe physical distancing has been an issue. So if you expand the hours, it just makes sense that it's less number of stores because we're making the hours of operation more available for people. And so, from those that I spoke with yesterday, they made the point that reducing the hours would actually limit the number of hours that people could shop in their locations for essential items, and that the best way to do it is exactly what we suggested yesterday, just to expand the hours so we reduce the density, and they felt they had the appropriate measures in place to make sure that the proper cleaning procedures, could be done within the existing time frame and even after hours if necessary.
One question that I've received probably more than any other is, if we're seeing so many cases, why not just shut the province down completely? Say nothing can open, everyone stays home, do that for 2 weeks, and then the virus will essentially burn itself out.
It won't.
Dr. Fitzgerald, I wonder if you could address, or Dr. Haggie. Yeah.
So that's not going to work, number one, and that's why we don't do it. So what we know about this virus is that, 2 weeks is the incubation period for one person being exposed to that virus. It's not the incubation period for a full population. So there may still be people who will come in afterwards, who will have the virus, and we will just end up having to do the same thing again. The evidence has been clear that 2 weeks of shutting everything down is not effective. This is going to be prolonged. It's going to take several months, and it's going to be social distancing and the measures that we have in place now, and that's what has made a difference, and that's what we're going to continue to do.
Locking people in does not necessarily not lock the virus out of Newfoundland and Labrador. This virus has been traveling around the world for over 4 months now. And so simply taking a 2-week period and keeping everybody inside and shutting everything down doesn't necessarily mean that it wouldn't be back in 2 or 3 months or 2 or 3 weeks' time. So that is not the solution, as Dr. Fitzgerald and the minister has said so many times. Continue to do exactly as Dr. Fitzgerald has been suggesting, and we'll work our way through this.
This is a marathon, not a sprint. We're going to be at this for weeks yet and maybe months. And that's why when Dr. Fitzgerald's orders have been issued, what we're saying is, what do we need to keep life going at a basic level over 3 months? This is not 3 days, it's not 2 weeks. This is at least 3 months. And we're only into the beginning of week 3.
We're hearing that some employers are requiring people to have a negative test before they're allowed back to work. This may be someone who exhibited a few of the symptoms. The symptoms have gone away, but they're requiring a test. What's your advice to employers who are requesting things like that?
So public health has criteria in place for what constitutes someone being considered recovered from COVID-19. So our criteria right now for people who have mild to moderate disease, who were not hospitalized, who are not healthcare workers, who are not immune compromised, that after 10 days from symptom onset, if their symptoms have resolved, we consider them recovered and clear to go back to work.
Okay, thank you.
Reporters are reminded that we have about 6 minutes left for questions.
Thank you. The next question is from Ben Murphy from BOCM News. Please go ahead.
Minister Haggie, hearing rumors, emphasis on rumors, that someone who was in attendance at call resides at one of the long-term care homes here in the city and has tested positive. Can you speak to that or at least just squash that rumor?
I have no information that would support that contention. And I think one of the things I would suggest is that Facebook is probably one of those sources where you really need to consider the source of your information. If you want to know what's going on about COVID-19, there are websites that we provide that will provide you with information. And I think rumors need to be regarded as just that.
Mm-hmm. And we've received complaints from people saying all visits of children in the Eastern Health foster care system have been suspended. Some people are saying losing these visits could have big consequences. Is this true, and why was this necessary?
So the foster care program you're asking, Ben?
Yeah.
No, that's not something that I've been aware of, and we've been talking to that department as late as yesterday afternoon, and we get our updates usually on a daily basis. So that is not something that would have been brought to my attention. And if it is, we'll find a way to work around the system to make sure that the children that need foster care will get that in a safe place.
And are there concerns that industries like tourism and the small businesses in tourism may not survive if this does, in fact, go well into the summer, as it's a crutch for much of rural Newfoundland and Labrador?
Yeah, so I think people have heard me speak many times about the pandemic and the health crisis that we're facing and currently dealing with in our province, and that is our priority right now. But we certainly is on our minds as well when we come through this successfully, and we will, is what will happen and what will the economic impact be in Newfoundland and Labrador. Tourism operators, our fishery, so many industries within our province right now has been just shaken, and as the province's economy has been brought to a standstill. So the federal government has put in some significant programs to support industry right across the country. And in addition, as a province, we're prepared to work with industries as well, making sure that they are positioned to come out of this strong, because as we all know, they are the employers and they generate the employment in Newfoundland and Labrador. We need to make sure that they're available and ready once we get through the health crisis to deal with the economic crisis.
Thank you very much.
Thank you. The next question is from Kellyanne Roberts from NTV News. Please go ahead.
Thank you. Wondering if there is a plan in place to administer vaccines that generally go in the later half of the school year to elementary students.
That's a good question, actually. From our point of view, the vaccine program for children and youth should go ahead. It's an important public health measure all of its own. For those children who might have received it at school, if that still goes on, then obviously we would have to have those discussions with education and early childhood development to identify them. Certainly from the point of view of the provincial vaccine program, we would like to ensure that that continues.
Thank you. And the 4 cases that were announced today in Eastern Health, do we know if those have been linked to any particular area, if they're from travel or from contact?
No, we don't have that information at this time. Those investigations are ongoing.
Okay. And do we have a breakdown of region testing?
Did you say regional testing or recent?
That question was already asked, and the minister said that he would get that information.
That was yesterday, though. I'm wondering if we have an update.
Regional testing.
Yeah, no, certainly we can provide that for you. In actual fact, we're trying to get that on a regular basis from the public health lab. They will get that for us.
Thank you.
Thank you. The next question is from Peter Jackson from The Telegram. Please go ahead.
I just want to try to fit in one question. You listed an alarming number of healthcare workers who are on in self-isolation or self-quarantine. Do you have any idea how many of those are frontline workers, such as nurses or doctors?
No, we could try and break that out by discipline, by specialty. I would argue in this current situation that anybody who works in healthcare should be considered as a frontline worker.
Okay, thank you.
Thank you. There are no further questions at this time.
Thank you very much for attending, folks. Our time for questions has ended.